Good afternoon. My name is Michael Sullivan, and I want to welcome you to today's webinar focused on the text Cleft Palate and Craniofacial Conditions, 4th edition, hosted by author Dr. Ann Coomer. We're also joined by my colleague, Liam Butler, Solutions Analyst, who will provide a product demonstration of Navigate 2 course a little later in the presentation. Before we get started, I have a few notes and reminders. All participant lines have been placed on mute. If you would like to ask a question during the presentation, please refer to the questions pane on the control panel and send them to me, the organizer. I'll be collecting these questions for Q&A at the very end of the presentation. Today's PowerPoint slides have been made available to you and can be downloaded from the handouts pane in the control panel. We're also recording this presentation, and the link will be sent to you post-webinar in a follow-up email. Now I'd like to turn the presentation over to Ann.
Hi, everybody. First of all, I want to sincerely thank you for your interest in this book, but most of all for your interest in doing the best that you can for those individuals affected by cleft palate and other craniofacial conditions. I really appreciate that. I want to start out by telling you a little bit about why I'm so passionate about dealing with or helping individuals with cleft craniofacial conditions and VPI. Maybe it started with when I was a teenager, and my dad was an otolaryngologist, and he had me work in his office on Saturdays while I was in high school, and then frequently in the summers when I was in college. And I really loved what he did, but I didn't want to do what he did. And honestly, I think I would have been a terrible surgeon because I have absolutely no patience whatsoever. But he actually sort of convinced me to look into speech-language pathology, and I'm really glad he did because it was a really great career move for me. So I've always sort of been interested in the medical aspect of speech-language pathology. The next thing is I want to tell you a true story of what happened to me my first year in clinical practice. I finished my master's degree at Indiana University, and I felt like I was very well trained, and I was really ready to take on anything that you could throw at me. And so my first job was working in the public schools in North Carolina. And on my caseload, what happened is I inherited a caseload from a previous speech-language pathologist, and on that caseload was a little boy who was 9 years old, and I read through the notes and found that he'd been in speech therapy for 3 years. And during those 3 years, he had made no progress whatsoever. Well, I couldn't even imagine why you would not make progress being in speech therapy. And so, I read the notes, and then I decided that I was going to do an evaluation and then see if I could help him further, make sure that he made progress during that year. So I did an evaluation, and what I found was that he had absolutely perfect articulation, but he had terrible speech. And in fact, at times he was unintelligible, and his speech was really hard to listen to. Okay, so in my great education at Indiana University, I had one course on voice disorders and one class on cleft palate and speech disorders associated with cleft palate and VPI, velopharyngeal insufficiency. All right, so being the expert that I absolutely wasn't, I thought that maybe this child had VPI and had a leak of airflow through the velopharyngeal valve. So what I did was I called the parents and I talked to them about my suspicion, and I suggested that they go see an ENT. They agreed with that. They took their child to see an ENT. The ENT looked inside the child's mouth, said everything's fine, and recommended further speech therapy. Now, I'm ashamed to tell you today that that's what I did. I did speech therapy for another year. I can't even tell you what I did because obviously I wasn't trained to do therapy for something like this. So I was just really trying anything and everything I could think of. Well, here's the thing, is at the end of the year, What I did was I accomplished one thing. And the one thing that I accomplished was I further negatively affected his self-esteem. Because what I know now that I didn't know then was that, yes, in fact, this child had VPI, and this is a structural problem. It's not a functional problem. VPI cannot be corrected with speech therapy. It requires surgical intervention. What I didn't know was that ENTs don't have the training in speech disorders or even in VPI, in velopharyngeal function. That's a specialty area. So what I should have done is I should have referred the child to a craniofacial center where there would be plastic surgeons, at least one speech pathologist, and maybe an ENT who specialized in that area. Had I done that, this child probably would have gotten the surgery that he needed. Now, I've thought about that over the decades of my career, and I've always wondered whatever happened to him. Obviously, I was not able to help him. I didn't do the right thing. And I wonder what happened to him as he continued through school. Did he continue in speech therapy that was useless and made him feel like he was a failure? Did he have educational and vocational opportunities that the rest of us have? So when I started working at Cincinnati Children's, about 2 years after that, I was assigned to the craniofacial team. And as I started working on that team, I read lots of books and lots of articles and really educated myself on this. And over the years, I've had a tremendous opportunity to learn and discover how to best manage children with clefts, craniofacial anomalies, and VPI. And so I'm really passionate about this area. Another reason I'm really passionate about this area is that in my career, I have seen so many kids who are in speech therapy that need surgery. In fact, sometimes in our craniofacial team, I'll see kids that come from out of town, and the child's been in therapy 8, even 9 years with no progress. Can you even imagine that, when all he needed was the surgery, not speech therapy? I've seen the opposite, where kids had either compensatory articulation productions and they had more surgery for that, or they didn't have VPI at all. They had phoneme-specific nasal emission or hypernasality. And instead of getting the right speech therapy or even the right diagnosis from the speech pathologist, the child ended up getting surgery that was useless for the child. So again, I'm really passionate about this area, and so I have put my heart and soul into this book and making it as informative and helpful as I possibly can, so that nobody has the experience that I had my first year in practice, and that these kids get the right services that they need. All right, I guess I've talked a little bit about my education, but just to tell you what my qualifications are for writing this book, I guess it starts with my education. That is that I got both my bachelor's and my master's at Indiana University, and then I worked for several years and then went back for my PhD at University of Cincinnati. And so that's my education. Now, I have a lot of clinical experience. I've been in practice for 45 years. That makes me really old. I realize that, but I'm still really passionate about this area, and I'm still working, seeing patients. Of those 45 years, I've worked 42 years at Cincinnati Children's, and of those 42 years, about 40 of them were focused on primarily kids with clefts and craniofacial conditions and VPI. During those years, I've served on the craniofacial team through the Craniofacial Center at Cincinnati Children's. I've also served the craniofacial program at Cincinnati Shriners Hospital, which is actually right across the street. And the difference between the two programs is that the Shriners Hospital provides all care for free, and those kids come from all over the country. So I can see the results of surgeries from surgeons all over the country. and that's been a really good learning experience for me. The other thing is in the 1980s, one of the ENTs and I started a clinic called Velopharyngeal Insufficiency Clinic, VPI Clinic. And at that time, he specialized in VPI. So he's one of the few ENTs in the country that specialize in this area. We started out with a mission of serving children with non-cleft VPI. And initially, we had a clinic quarterly. And then what we found is that the word got out that we had this clinic and we were getting more and more referrals. Also, as I was teaching and doing a lot of lectures locally and even nationally, we were getting a lot of referrals from those lectures. And so now we have a clinic we have two speech pathologists, an ENT and a geneticist. And we have a clinic 3 times a month, and we usually see about 8 patients per clinic. And so it's grown quite a bit because really there's a huge population out there of kids and even adults with non-cleft VPI, and that clinic serves that particular population. Additionally, I was approved to perform nasopharyngoscopies in the late 1980s, and since then I do all the nasopharyngoscopies for the Craniofacial Center. The ENT does the nasopharyngoscopies for our interdisciplinary VPI clinic where they're non-cleft kids, and that's really helpful too because I've learned a lot about the other ear, nose, throat type of conditions that often occur with syndromic patients or patients with non-cleft VPI. And then finally, my entire practice was focused on children with clefts and craniofacial conditions, and therefore I literally have evaluated and treated thousands of children in my career. So I have had the best career. It's not over yet. I'm still doing clinics and seeing patients, but I have been very fortunate to gain a tremendous amount of experience, not just book knowledge, but clinical practical experience. And I've learned a lot over the years. In fact, I know a lot more now than I did even 5 years ago. I continue to learn, and this is one of the reasons I wanted to share this information through the book, is that I've had opportunities that other people have not necessarily had. Okay, so I'm sorry, that just sort of stuck for a minute there. Okay, now I've had a lot of teaching experience as well. I started out teaching at the University of Cincinnati about 15 years ago, and actually, I had done some teaching prior to that on the university level, but it wasn't a full course. And I started teaching the Cleft Palate Craniofacial course at University of Cincinnati 15 years ago. I started teaching at the University of Kentucky 7 years ago, at Miami University of Ohio 5 years ago, St. Mary's College 3 years ago, and then I do an advanced class for California State University in San Marcos. That's an online class, and I started that 3 years ago. So I figure that I have taught the craniofacial or the cleft craniofacial course about 33 times, and actually I'm going to do it for University of Kentucky in the month of December. So, and I'm going to continue to do that. In addition to that, I love teaching, and I have done regular lectures for the medical divisions at Cincinnati Children's. I didn't include pediatrics here. I do pediatrics and dental, plastic surgery, ENT, and even rehab. So every year I do certain lectures for each of these different groups. And then on my CV, I just sort of glanced at that, and I found that of the local and state lectures and seminars that I've done exactly 100 on my CV as of today. I've done 246 national lectures, and I would say about a third of them are all-day seminars, and some of them are 2 or 3 day courses. And then I've done invited lectures internationally. I've been to a lot of different countries, and I've done 48 of those, including a 3-day course in Turkey, and a couple of other places where I've done 2 or 3-day courses. So I have a lot of experience teaching. Now, because I have a lot of experience teaching, I've gotten better at it over the years, and I've sort of realized what students want and what they don't, how they learn and how they don't learn. And I've found ways to help them to learn and be more successful, and I'll talk more about that in a little bit. I've also had a lot of writing experience. I always prided myself as a good writer because I had an incredible teacher in high school that really helped me write, and I loved writing. And so that really served me well the first time I decided to write a textbook. The first edition of my textbook came out in 2000, but I started it around 1997. It's a very long process. And I got kudos on that textbook for the fact that it was an easy read, that it was a simple to read. And what I've done is I've honed my writing skills over time. And with this one in particular, I literally looked at every single sentence to make sure it was really clear, and every paragraph to make sure that I had a really good topic sentence, that the information flowed well. I looked for opportunities to take out any additional words so that I could make it very simple. I got rid of all kinds of redundancy from one chapter to the next. So my goal was to do this text in a way that students could read it and get the information easily and quickly. I've also written a lot of book chapters, 23. I'm going to do my last one, I think, coming up in March, so maybe end up with 24. I've done over 50 peer-reviewed articles that have been published, and I've done many invited articles for ASHA and for other reasons, other organizations. I have some related service and advocacy interests, and these include organizations that deal with cleft lip and palate. So the one is I've been an active member of the American Cleft Palate Craniofacial Association since 1984 and served on many committees. I always present there. If I don't present, I don't get paid to go. So there's a little motivation there. But I love to present because I like to share what I've learned with other people. I've served on 3 international cleft palate missions, and then currently I serve as the speech pathology advisor for Smile Train, and we're working on trying to get these books at all their different partner locations. There are thousands of them, but we're working on that. And we're also working on a way to provide speech therapy remotely through telehealth. So I think there are a lot of opportunities to really improve the services for children with cleft lip and palate in the developing world. Okay, so why did I write this text to begin with? Well, in 1998, I guess that was the year, I was really frustrated by the lack of good texts to teach this course. I felt like that the current texts were very research-oriented and not very clinically oriented. I didn't feel that the text really focused on how to do it. More so, they looked at different studies and what the studies found. And I don't think students, initially when they're just learning the content, really identify with that. They need to know how to do it. And so because I'm a clinician at heart, I've done research. I like research, but I'm really a clinician at heart. I wanted to provide a textbook with really basic clinical information, including general instructions and specific instructions on how to do it. how do you evaluate the child? And even more specifically, how do you treat the child? And that includes specific speech therapy strategies. Like I said, I have been fortunate to have had a lot of clinical experience due to my position. And one thing, particularly in terms of speech therapy, is I know some techniques that are like magic to me now that I didn't know even 15 years ago. I wish I'd known them then because I would have done a better job for my patients. All right, so I wanted to share my knowledge for the benefit of clinicians, but particularly for the benefit of the children that they serve. All right, so the importance of this information. Why is this information important? Well, one thing that frustrates me greatly is that this type of course is not a required course for competencies to become ASHA certified, and therefore it's not offered at all universities. The interesting thing is that every time I get my evaluations back from teaching the different courses, the course that I teach at different universities, the most common comment that I get is, this should be a required course. And I agree with that. It seems like it's self-serving, but truthfully it's not. But the problem is that speech pathologists don't get a lot of information about basic oral anatomy and oral facial anomalies that affect speech. And that's really a concern when we're working on speech sound disorders. The students don't get enough information or any information about the effect of dental anomalies and dental malocclusion on speech. For example, one of the things I always focus on in my courses and also in the book is that the most important relationship, oral relationship for speech production, is the relationship of the tongue tip to the alveolar ridge. That tongue tip needs to be able to move up and down and back and forth without any obstruction, and it needs to be right underneath the alveolar ridge. If the teeth are affecting that tongue movement, or if the tongue tip is under the palate or in front of the alveolar ridge, that's going to cause speech sound distortion that cannot be corrected in speech therapy. That requires a physical management, either orthodontics or even surgical correction of the malocclusion. And yet I see that kids are getting speech therapy all the time when the problem is structural and not functional. And so that really concerns me. It concerns me about our profession. Velopharyngeal function and dysfunction. Students get very little information about that. And so the problem is that if the child has VPI and it's non-cleft VPI, a surgeon can't identify that, an ENT can't identify that. If the speech pathologist can't identify that, these kids are not going to be treated. And that's really a concern. In addition to that, I'm sorry, I didn't like that. In addition to that, we are not teaching students, or in most cases, students are not getting information about resonance disorders. And there are a lot of causes for resonance disorders, including enlarged adenoids. I've seen kids in therapy where the problem is enlarged adenoids or enlarged tonsils. And that's easy to see. All you have to do is look in the mouth. And yet, sometimes that gets missed. One thing that's so critically important for students and then ultimately clinicians to understand is when speech therapy is appropriate and when physical management is appropriate. As I said before, a lot of kids are in therapy when physical management is what is needed, and vice versa. And so this is really critical, and yet students aren't getting this information, and clinicians don't have that. And then finally, when to refer to an ENT and when to refer to a craniofacial center. So that's just a few things that I think are really important for all clinicians to understand. And it's not just pediatric SLPs, but also those SLPs that work with kids adults with neurogenic disorders and other things. All right, so this is why I wrote the text, and this is the fourth time I've written this text, and this, by the way, is absolutely the best text that I've done, and for various reasons. One is I have more experience. The other is that I knew exactly what I wanted to change and how I wanted to really improve this text. But the third reason is that by far Jones & Bartlett is the best publisher I've ever worked with. The quality of their work is exceptional, and I think that you will see that. And they didn't pay me to say that, by the way, but it is true. So looking at the text, the overview is that I have some general sections. So the first section is normal and abnormal structures. And in that section, I have a chapter on the anatomy and physiology. And it helps the student to put everything together, not just the anatomy, but also the different subsystems of speech and how they all work together, and how, for example, if the velopharyngeal valve is open, so we have VPI, that can affect breath support that sometimes is misdiagnosed as a primary problem with breath support, but it's really a problem of the velopharyngeal valve where there's nasal emission as a result of that opening. And so in that anatomy and physiology chapter, I help the students put that all together and understand how the subsystems work together as a team. There's also a chapter, of course, on different types of clefts. There's a chapter on syndromes and different craniofacial conditions and general dysmorphology. And in that chapter, there's a really nice table, I think it's really nice, that sort of summarizes the features of different craniofacial conditions. So the student can, at a glance, or the clinician at a glance, can look up information and compare and contrast to isolate which condition a particular child may demonstrate. The next section is called functional effects, and in this particular section there is a chapter on feeding and a chapter on how clefts and craniofacial conditions can affect the child socially, and the effect on basically the psychosocial development of the child. Let's see, I'm just looking here because I can't even remember developmental aspects. And then, of course, how these craniofacial conditions affect speech and resonance, and more about velopharyngeal dysfunction. The third part is all on assessment, and the chapters include the perceptual assessment chapter. There's a chapter devoted specifically to the oral facial examination. That's something that students are rarely taught in graduate school. And then there's a chapter that's an overview of instrumental procedures. And this is the chapter that I would recommend that an instructor would use for graduate students, because they don't need to know the details of all these different instrumental procedures, but they need to know what each procedure does, the advantages and the disadvantages, and how to interpret the results. Basically, if they receive a report from a craniofacial team. Now, if the person is a clinician and is specializing in these areas, there's a full chapter on nasometry, another one on video fluoroscopy, and then a third one on nasopharyngoscopy. Part 4 is dedicated to treatment, and that includes surgical management, one chapter on surgical management, another one on prosthetic management, and then one on speech therapy. And actually, I think the speech therapy chapter and the evaluation chapters Both are appropriate for kids with any type of speech sound disorder or resonance disorder, not necessarily associated with cleft lip and palate or craniofacial condition. The last section involves interdisciplinary care, and so there are 2 chapters in that section. One is called the team approach, and then the other is cleft care in developing countries. And then finally, there's an extensive glossary at the end of the book. And I remember when I was studying for the exam right after I finished my master's degree, and I was studying for the praxis exam, I had an old book. I can't even remember the name of it right now, but it had a great glossary. And just studying the terms and the definitions, I think, really made a big difference for me. And I think that this would be very helpful for the students as well. Now, within each chapter, the very first page within each chapter has a chapter outline, so you know exactly what the chapter is about. The chapters are filled with tables that have things like comparing one thing and contrasting with another, or tables of definitions. For instance, in the dental chapter, there are a lot of definitions, and so there is actually a table with some of these definitions. In the chapters on dental anomalies or on surgical treatment, what I have is a section called speech notes. And so, for example, as we're talking about a class 2 malocclusion, there's a separate box that discusses how class 2 or how class 3 malocclusion affects speech. And so that's highlighted in the text. You don't have to dig through that text to find how those particular anomalies affect speech. There are a lot of definitions within the text, and every one of those is also in the glossary. And the definitions, if there is a term and it's used for the first time, it's in sort of a green color, and it tells you that's a definition, and then the definition follows it. And then finally, at the end of each chapter, there's a section that's called for review and discussion. And what this is that there are questions that are designed to make the student think and to analyze. And so it helps the student to pull the information together rather than just memorizing. They can assimilate some of that information and analyze it. And some instructors have used these questions for essay tests. Others have used it just for discussion within class, and then others have used it as a homework assignment where they assign, say, question number 4 and ask the student to answer that question and then turn that in. So there are a lot of different uses for that particular section. Now, one of the best features of this book, I think, and this is a brand new feature, is the speech therapy cookbook. This is in the speech therapy chapter, and it's called Cookbook for a reason. And the reason is I remember when I was a sophomore in college, majoring in speech pathology, and I took a class on articulation. And it was taught by a man who was well known at the time, had published quite a bit on articulation disorders. And we finished the class, and I remember raising my hand at the very end of the class, and I said, but what about speech therapy? When are we going to learn how to do speech therapy? And his answer to me was, Anne, if I gave you a cookbook, then you'd never be able to figure it out for your own. And therefore, this is something that you have to figure out on your own. Well, I'll never forget that comment because for years I've wanted the cookbook. And the reason is that for years I've been trying to figure it out and not always getting it right. And so after a while, when you keep doing trial and error, you start to realize what works and what doesn't. Or you discover a technique that is amazing that you wish you'd known 10 years previously. So what I did was I took the techniques that I've learned for correction of different sound disorders, and the techniques really apply not just to compensatory articulation productions, but for speech sound errors for a variety of other reasons. And I've put those together in my speech therapy cookbook. And in this cookbook, there's specific instructions on how to provide auditory feedback, tactile kinesthetic feedback, and visual feedback, and then specific instructions on how to achieve appropriate placement. So I hope that that will be of great use, and people will take advantage of what I learned over many decades and will be able to build from there rather than starting from scratch, so to speak, and learning it on their own. Now, features within the text. There are a lot of features within the text, including the colored headings and tables. I love that about this text. It's a really pretty text, and again, I take no credit. This is because of the quality that you see in the Jones and Bartlett books. All of the anatomic drawings are original and in color, and they're all the same style because they were all redone by Jones and Bartlett, and so I love that. And then this is the first book that I've had where the photos are in color, and you can see that makes a big difference, much better than black and white. Now, this text has a lot of benefits for instructors. And as an instructor, I can tell you some of the things that I like the best about this text. The first thing that I like is that there's an ebook. And with the ebook, the videos are embedded for illustration. That's fabulous. So that what can happen is the student is reading about hypernasality, and then they can double click and see the videos that illustrate hypernasality. In addition to that, there are PowerPoint slides for all chapters with the colored anatomic diagrams, colored pictures, and also with embedded videos. So really the instructor can use these or modify them in any way. And they're for all chapters. When I teach a Cleft Palate class for students, I don't use all chapters, but they are there. They're available. In addition to that, the instructors get multiple choice test questions with the answers for all chapters. And so if you want to create a test with multiple choice questions, you can pick and choose the questions from the chapters or use them all for that matter. Now, in addition to that, the instructors get a completed version of what I call Cleft Notes for all chapters, and I'll show that to you in a minute, and then a library of almost 700 photos and illustrations and almost 300 videos. In fact, I think there are 296, so we're close to 300. The student benefits include the fact that the text was specifically written to make the information simple, clear, easy to read, and easy to understand. There are clinical instructions, how-tos, if you will, for evaluation and for treatment, including speech therapy. There are embedded videos for illustrations, lots of pictures, tables, diagrams, and illustrations, as we said before, and they get the incomplete version of the Cleft Notes. And so I'll show you again what that looks like. And then finally, they receive handouts that can be downloaded, printed, and passed out to their patients and the parents of their patients once they're in practice. All right, so let me show you the Cleft Notes. We're going to use the example of Chapter 10, and I'm going to show you the student version first, and then I'll show you the instructor version. So the student version looks like this. All right, so here we have these grids. The students are supposed to read the chapter, and as they read the chapter, they fill in characteristics of hypernasality. So low volume, for instance, use of M4B. They can make notes here. Possible causes. So it could be VPI. It could be phoneme specific, phoneme, and I can't even type, specific, etc. All right, so they fill these out. So characteristics of large opening, the volume of nasal emission, the consistency, the effect on consonants, the effect on utterance length. All right, so this is the student version. Now, I have the students fill out Cleft Notes for key chapters, not all chapters, but key chapters. And then here you have the answers. So the instructor gets the completed Cleft Notes, whereas the student has to fill these out as they read. Now, this is one thing that I think has really improved the grades of my students over the years, because what I found was that students were listening to the lecture, maybe taking notes, they were reviewing the PowerPoints, but they weren't really reading the chapters, and therefore they didn't have that in-depth knowledge. And so what I've done is I've asked them as an assignment, I have them fill out these Cleft Notes, and then when they fill these out, they turn them in to me before the midterm and before the final exam. And what I found is that they learned so much more. And I know that they actually read the chapter because they had to read the chapter in order to fill out the Cleft Notes. So it's really made a big difference, like I said, in grades. And I've gotten a lot of positive feedback from the students saying that they really like that aspect of the course, and that it really helped them to learn. It helped them to study for the test. And then they keep these notes for further reference once they get into practice. So Cleft Notes can be really helpful. As I said, I don't grade them, but I give them points for turning them in, and I look to make sure that they're completed. So if the student, actually completed everything, I give them so many points credit. All right, so now we're getting to the online part of this book, and I'm really proud of this. I think that Jones and Bartlett did a fabulous job in how they've put together the online features. So we've already talked about the ebook, the PowerPoints, the Cleft Notes, the test questions, the handouts. There is a video library, so all the videos and more that are in the book are in the video library, and also an image library. So what I'm going to do is I am going to turn this over. I'm sorry, I didn't even put this back here. I can't talk and think at the same time. Makes me nervous. Okay, so I'm going to turn this over to Liam. And Liam, would you please explain to everybody and demonstrate what these different features look like?
Excellent. Thank you, Anne. So I'm going to show you what Navigate 2 looks like for cleft palates and craniofacial conditions. I just want to mention a few things before I start getting into it. Navigate 2 does come included with each new textbook that is purchased, and it is also available as a digital access only, which can be bought at a discount from the book. You can also request a trial course or a copy of the course for yourself, or a demo through your account manager, and they can get that set up for you. They also have the ability to help get you the instructor resources outside of Navigate 2, but you will find them within Navigate 2 as well, as I'll show you. And then the last thing I want to mention is that Navigate 2 does integrate with Canvas and Blackboard. So it allows you to pair your Canvas or Blackboard course with Navigate 2, and that also allows you to pass back the overall course total from Navigate 2 back into Canvas or Blackboard. And once again, if you'd like more information on that, you can reach out to your account manager, and we can also set up a demo where we can go into more in-depth right now I'm just going to show you a quick overview of a lot of the main features within Navigate 2. So once you log into the course, you will see it is broken out by chapter, and it is in the order of the book, but you do have the ability to rearrange it, and you can customize it. You can add in your own content into the course. So this is very flexible. This is just how it is built right out of the box. So you'll see there's a topic for each chapter, and if we scroll down, you'll notice that we have a section for the handouts that we've added in, as well as this is the video library that Anne was talking about before. And once again, and I will show you once we get into the ebook, these videos are also built right into the ebook. So students can watch the videos as they're reading through the chapters. So if we click on each chapter, you will find there is a link to the ebook within each chapter, but once you open up the ebook, you will have access to the entire book. So once it loads up, it is in HTML5, so this will work with screen readers. And you can also very easily change the size of the text over here. So if you want to read the text in a bigger format, or if you go to settings, if you want the text to be smaller, you can certainly do that. It's very easy to add in notes into the ebook. If you come over here, all you have to do is highlight a section. You can add in notes, highlights. Students can also come in, make their own notes and highlights, and then as the instructor, if you want to share your notes and highlights with your students, you have the capability of doing that. Throughout the book, we do have the glossary terms that are found within the book. You will find that there's dotted underlined terms, and those are items that you can click on. And I'm just looking for an example right here, and it'll pull up that definition for you right away. So as you're reading the book, you'll get that definition no matter where it's found within the book. And then you can also come over here and click on the glossary, and you can pull up all the glossary terms right here. So you don't have to go to the back of the book to find them, but that is available within the ebook as well if you want to go back into the traditional view of the glossary within the book. Over here, we have the search feature, so you can search for keywords or terms. It'll search the entire book. This will show you whether it's found in the book or if it's found in one of the enrichments, which I'm going to touch on in a moment, but these enrichments would be the images, the audio items we've added in, as well as the videos that we've added in. Come back here to contents, click on enrichments. This is going to show you a list of all of the media items that we've added into the book. So that'll include the videos, images, and audio files we've added in. So to show you an example, I'm going to pull up a video and show you right here. So each video will come with audio that is included. Unfortunately, you won't be able to hear the audio because it's come out of my headset. But Anne's going to give just kind of a brief description of what this video is.
Okay, so this is just a technique that will redirect airflow from the back of the velopharyngeal valve to the front of the mouth. And it also works for a lateral lift. And so we're doing that right now with this particular patient. This patient, and this sort of shows you what the videos look like. They are real close to the child, and so that you can see the mouth and you can see the face very easily. They're not done from a faraway camera. The audio is very good. And the other thing is every one of these videos has been edited. And so they're no more than, I think there might be one that's more than 30 seconds, but they're very short, because one of the things that I found, and I found this by lecturing, is if I have a longer video, people start to get bored after about 30 seconds. They get the point in 30 seconds, and then they're done. And so what I've done is made this with these videos. It's like being in a virtual clinic, but you don't have to be there for the entire clinic. You just get the meat of that clinic. And so that's what all these videos are.
Thank you, Anne. And as you can see, I went over here and searched for the video, but as students are reading the ebook, they'll come across these videos that they can come here and play. As well as, once again, there's audio files that we've added into the ebook and made available on the main page of the course. Just one more thing I want to mention about the ebook is we do have an app that is available and that is available through the Apple App Store for iPhones, iPads, and the Google Play Store for Android phones and tablets. It's called Navigate eReader 2.0, and that's how students can read the ebook on a mobile device. They also have the ability to download the book, and if they want to, they can download the video. So they can go in and choose which videos they want to download. Because there is so many videos, we didn't want them to have to download everything because that could be a very large download on a mobile device. But they do have the ability to take those videos offline through the ebook, and they can access them at any point, even if they go to an area without internet access.
Liam, would you scroll up a little bit on this? This is an example of the cookbook. So this is the format. Okay.
Thank you, Ann. So if we go back to the course, next thing you'll notice, and each chapter has one, except for the last chapter in the book, is the flashcard. So this is going to go over the glossary terms within the book. So this is a really nice way for students to go through and practice the glossary terms. It'll give them the definition, and then the student will come over here, put in the answer, and then they can see if they got it right or wrong. And then they can continue on and do the next one. They have a question list up here. So if they want to see a list of everything they've gotten right or wrong in that one session, they can do that. Or if they just want to go down and skip to, say, 41 because they've done the first 40, they can go ahead and do that. These aren't graded. They don't report into any reports. They're purely just here for students to go through on their own and test their knowledge of the glossary terms. And they can go through them as many times as they like to. Then we have down here, these are the PowerPoint slides that we've added in that students have the capability of downloading. Once again, you can make your own edits to the PowerPoint slides, and you can always re-upload them into the course because you can add in your own content. So if you want to edit the PowerPoint slides or any other type of files, you can easily add into the course. And then here, this is where students are going to find the Cleft Notes for each chapter. So these are the same Cleft Notes that Ann had showed you earlier that students will have to enter, and then you're going to have your own instructor version that you can download as well. So once again, you can see all the chapters that we've had it in for the ebook. And then down here, once again, you can find all the videos. And then we put the video resource guide. We have one for each, a link to the video guide. Once you download the guide, that has a guide for all the videos in one PDF. So it's going to be the same guide here that will have everything for you. So these are all pre-built into the course for you. If there's any sections that you maybe aren't using, you do have the ability to hide items. And if you need to, you can also rearrange items. So if you come over here to these little move buttons, you can very easily move things around in the order that you want. So maybe if you teach in a different order, you can have that reflected within Navigate too. Up here, you'll notice there's a Learning Tools tab. Same content we just showed you. It just rearranges it in a different order for the students. We have all the ebook links together in one place. Over here in the Study Center, we have all the Cleft Notes together in one place. And then we also have all the videos together here in one place. So as you can see, there's a lot of different videos. If a student knows there's a particular video they want to jump right into, this is a nice place where they can go to find that. And then we have teaching tools. So this is where you're going to find the instructor resources within the course. So you have access to the handouts here. You have access to the PowerPoint slides. And then I didn't show you, but if you needed to share notes with your students, but you wanted to either share with the entire class or you just want to share with a particular set of students, you can come into Manage ebook groups. And from there, you have the ability to create groups, and then you can place your students into it. And then from there, you can share notes with the different groups that you've created. And then the last thing I just want to show you is you can come over here. You do have the ability to add in assessments into the course. You can also add in assignments into the course if you'd like. I won't go into too great of a detail, but if we come here to Navigate to Assessment, we have the capability of setting up the parameters that we need for this test. We can call it whatever we want. You can make these practice quizzes, chapter quizzes, multi-chapter tests or exams. You can do that. You have the standard features of choosing the dates and times, the time limit, how many attempts they're going to have within the test. And then once you go through the settings, you'll have the ability to come over here and pick the questions you want. So you have the ability to choose from the drop-down box what chapter you want. Once you click on chapter, you can see all the questions that are available. You can preview a question with the magnifying glass. So if you want to see what it is before you add to the course, you can do that. We do have lots of different types of questions. So we do have matching questions. We have labeling questions, true and false questions, multiple choice. These are all items that will grade automatically. And then you can come over here and add them to the test. And then once you add to the test, this will automatically report into the gradebook. So once you create the test and you create any assignments, if you go to reports and grades, you have the ability to pull up all the grades. You can customize the gradebook. So if you want to set up weighted grading within the course, say make quizzes 30%, assignments 20%, exams 50%, you can do that. Or if it needs to get more advanced, that's something we can help you get set up within the gradebook. So that's just a brief overview of what comes with Navigate 2. Once again, if you'd like to have a demo, a more in-depth demo with it, or want to get access to a course that you can go in on your own, please reach out to your account manager, and they'd be more than happy to get that set up for you. And at this time, I'm going to pass it back over to Anne.
Okay. Thank you very much, Liam. I think you can understand why I decided to go with Jones and Bartlett. I was so blown away by the Navigate 2 when I was looking for a publisher, and I'm so glad that I chose them because I'm just so impressed with what they have done with this book. All right, so why this text? I think that this is more than a textbook. Obviously, there's a lot to this textbook. It's really a complete course for the instructor. And you've got everything that you need as an instructor. But, I realize that there are a lot of universities where they don't have anybody to teach the class. And so because of that, what I plan to do, I'm working with Jones and Bartlett on this, is in March, I'm going to record lectures for key chapters. And so ultimately, there will be the opportunity to add pre-recorded video lectures to this whole package. So I hope that will help those universities that don't have anybody to teach the class. That would be awful. All right, so now I'm going to pass this over to Mike. And Mike is going to tell you a little bit more about how to order the book. Mike, did you get that? Yep.
Yep, I'm here. I'm just setting up the presentation.
Okay.
Awesome. Hello again, everyone. If you're interested in using this textbook for your course, please provide the ISBN 13 shown here to your bookstore. Also, if you go to go.jvlearning.com/Coomer, you'll be able to request a print or digital review copy of the textbook, access to Navigate 2, access to the instructor resources, and will be able to purchase a copy of the textbook if needed for personal use. If you are purchasing the copy for personal use, please use the coupon code Coomer30 to receive 30% off and free shipping. All right, so due to time constraints, we won't really have time to take questions, so we can take them offline. You can reply to a follow-up email I'll be sending shortly after the webinar. As I mentioned before, this session has been recorded, and you'll be receiving a second follow-up email with that URL and a link to the catalog page to order any of the materials that we mentioned within 1 to 2 business days. I would also like to extend a very big thank you to Ann Coomer and Liam for joining us today. We hope to see everyone at a future Jones and Bartlett webinar. Thank you, everyone, and have a great day.
Thanks, everybody.